And thank y'all for joining. Good evening. My name is Christy and I work for Medtronic. And tonight I have the pleasure of hosting this webinar where you're going to get to hear from Dr. Justin Ellett. Dr. Ellett was born in Richmond, Virginia, and he attended Hampton-Sydney College, where he graduated summa cum laude with a BS in mathematics and biology. And he was actually elected to Phi Beta Kappa. He then completed the MD PhD program at the Medical University of South Carolina, where he was the Distinguished Graduate of the Year. His research focused on transplantation immunology, and then he stayed at the Medical University of South Carolina for his internship and residency training, where he was fully trained in minimally invasive surgery, including robotic surgery. Dr. Ellett joined Lowcountry Urology Clinics in mid-2016, and he has special interests in all aspects of urology, including medical management of stone disease, men's health, robotic urologic surgery, and bladder and bowel control issues as they affect men and women. And this is what we'll be discussing tonight, along with a therapy called InterStim. As I mentioned, I work for Medtronic, and that's actually the therapy that developed this therapy. And while you might not know the name Medtronic, you probably do know somebody who's had a pacemaker, and that's what we're most known for. So without further ado, I'm going to pass the mic to Dr. Ellett so you can hear more about this. But before I do, just a few more reminders. Everybody's phones were muted upon entry. So if you have a question, and we really do hope that you will, please feel free to type it in the Q&A box at the lower portion of your screen. All names will remain anonymous, and we'll get to those following the presentation. Likewise, please answer the anonymous poll questions during the presentation. That would have shown up as a little box on your screen. That is also anonymous and really helpful information for us to have so that we know what to do next and how we might be able to better take care of you. There's also going to be an anonymous survey at the end where you'll be able to provide feedback and things like that. So we hope that you'll answer that as well. Again, it'll be anonymous. So now, finally, let me welcome Dr. Ellett, and thank y'all for being here.
Hey, everybody. Thank y'all for coming. We're going to talk about some slides and a little background on overactive bladder, and then I really would encourage anyone to put any questions that you might have into the chat box. I think that's the most fun and often the most informative part of these talks. So please, if you have any questions, don't hesitate to put those into the chat box so we can get to those at the end. So really, we're going to talk about overactive bladder and all forms of urinary incontinence tonight. We see a lot of patients that come in, and really they're nervous that they're having this issue, and they don't know that they're ever going to regain control of what's going on, and they've really modified their lifestyle significantly to work around these issues that they're having. They're afraid to go out in public because they're not sure whether they'll be able to find a bathroom. They're afraid of leakage. They're afraid of new relationships because of these issues. And they're more than 50% of these people haven't discussed these issues with the physician. And we really want to encourage patients to do that. And we're going to talk about some background to that and some ways that you can kind of bring it up. So really kind of the outline for the evening is that we're going to do some background on bowel and bladder control. We're going to talk about something we call a care pathway, which is how we try to work through the bowel and bladder control issues to arrive at a therapy that's going to work for each individual. We'll talk about those treatment options. We're going to talk about some options that the Medtronic platform has for the various issues. And then again, we're going to get to the Q&A at the end. So really the most common, the thing that I like to really impress upon people that come to me with these issues is that you're really not alone. Overactive bladder and fecal incontinence are extremely common. Overactive bladder affects somewhere around 37 million Americans, which is more than those with vision problems and with asthma combined, two things that we consider generally very common issues. But nobody really talks about overactive bladder as much. And even more than that, patients are really embarrassed to talk about fecal incontinence, which can affect up to 1 in 12 Americans, which is 20 million people. There's a lot of people that are embarrassed about these issues and are afraid to bring them up. And so it's really important to know that these are not things that we're afraid to talk about, and they're very common things. So really one of the things that I like to talk to people about is that urinary and bowel incontinence are not normal. They're not always something that requires us to treat them super aggressively, but they're not normal. Any of these things may indicate that there's an issue with bowel or bladder incontinence. Having frequent accidents, whether it's a stool accident or a urinary accident, having to rush to the bathroom because you just can't hold it anymore, planning your activities around timing going to the bathroom, or planning your activities around facilities that have an easily accessible bathroom, and knowing one of the very common things I hear from patients is they know where every bathroom is in the Walmart, in the grocery store, and the Lowe's. They know exactly where they are and they know how to get there quickly. Patients will alter how much they eat and drink. I have sometimes have patients come in that even kind of live on the brink of dehydration because they're afraid to drink because they don't want to have to go to the bathroom, especially when they're in public. And people are having to invest a lot of money sometimes, but also having to wear pads and protective garments to help prevent having leakage around the house or in public. But the real issue here is that there may be an issue going on that we can certainly help you evaluate, and we have good treatments for. So we're going to try to keep this as high level as possible here, but on a very superficial level. Kidneys produce urine, comes down the ureters to the bladder. And when on a normal basis, when the bladder is full, it's about half full. It stimulates nerves that kind of let you know that you need to go to the bathroom. And as that signal worsens, as the bladder gets more full, the brain says, okay, it's time for us to find a place to go to the bathroom. Unfortunately, sometimes we'll see a communication breakdown, kind of like being in a crowded room when versus listening to someone talk at home. That background noise can sometimes cause a communication breakdown. So instead of your brain sending a normal signal to your bladder that says it's time to go to the bathroom, it sends an inappropriate signal to your bladder that says it's time to go to the bathroom. Sometimes that results in the bladder going to the bathroom, even if you're not ready for it to. And that breakdown or that normal communication is essential for normal bladder control. And those breakdowns are where we start to see issues with bowel and bladder leakage. And it's very much the same with the bowels. As you eat, your intestines kind of work the digestive material through, which can take anywhere from 24 to 72 hours. And as these muscles are squeezing the food through, it ultimately gets through to the lower intestines in the rectum, and the rectum, when it gets full, stimulates nerves that tell you it's time to have a bowel movement. And normal reflex, your brain says, okay, let's go find a bathroom. It's time to go to the bathroom. And when it's time to go to the bathroom, those sphincter muscles relax and you have a normal bowel movement. However, we see the same breakdown in that we see with bladder control. And sometimes there's inappropriate or mixed communication or communication breakdowns between the brain and the bowels, causing leakage when we're really not in a position where we're ready to go to the bathroom. So things that can cause incontinence, it's different in everyone, and we do this this is a very personalized assessment when we're talking to patients about this to try to really identify what the issues are for each individual. But some of these things can include daily habits, can include dietary things, what you're eating and drinking, not just how much, but actually what you're eating and drinking. Other medications can sometimes be responsible for this, and over-the-counter supplements can be included in that category. Reduced mobility can lead to issues with incontinence for various reasons. And then what I even consider one of the more common reasons is pregnancy, childbirth, radiation. We can do radiation both men and women for various pelvic cancers or pelvic floor injuries, which can result from trauma in both men or women. All of these things can lead to incontinence for various reasons, and we try to work through these reasons to identify what the cause is and what our possible treatments are. So really, there are three common bladder control problems, and we're going to address these individually, so I'm not going to spend much time on this slide, but there's stress incontinence, urinary retention, and then an overactive bladder. And under the umbrella of overactive bladder comes urgency and urge incontinence, which is the other type of incontinence we're going to talk about. So stress incontinence is exactly what it sounds like. So stress from coughing, laughing, sneezing puts puts pressure on your bladder when you're kind of bearing down to cough, lap, or sneeze. Similarly, when patients bend over, lift something heavy, they'll have a little bit of leakage with that. Sometimes it's severe enough when patients are standing up from sitting down is a common issue I hear, climbing stairs. That's all included under the category of stress incontinence. It often leads people to go to the bathroom very frequently because having an empty bladder makes you less likely to have this leakage. And so it really has a big impact on lifestyle because patients are trying to find the bathroom frequently. None of the most of the therapies we're going to talk about tonight are not going to focus on this, but we absolutely I think it's extremely important to work through this and tease out stress versus urinary or for urge incontinence. And many times they coexist. It's very common for either men or women to have both issues, and I think it's important to tease them out because the therapies are different for both, and treating one won't help treat the other. So sometimes we need to treat them individually. So urinary retention is basically the inability to empty the bladder. Sometimes that occurs in patients who can't tell that their bladder is full. They have a full bladder. It's not sending the right signals to the brain to say, I'm full, it's time to go to the bathroom. Symptoms that patients will perceive are either sometimes they'll feel that they can't empty. Sometimes when they try to go to the bathroom, the flow is weak or it just kind of dribbles out. Some of these patients actually end up needing to use a catheter to fully empty their bladder, which is a really frustrating situation because you're not getting the right signals. And some of the treatments we're going to talk about can help with certain types of urinary retention. And then the third type of incontinence that we're going to talk about tonight falls under the umbrella of overactive bladder, where patients will have what's called urge incontinence, which is an urge to go to the bathroom that then leads to an incontinent episode or leakage. Sometimes you'll have that urge, you get up to go to the bathroom and you just can't make it in time. That's a very common complaint or symptom that patients will have. Frequent leakage, they'll have an urge to go to the bathroom and the bladder just does what it wants to and it will leak. Very common triggers that I hear are every time I take a sip of water, I feel like I have to go to the bathroom, or washing the dishes at night, turning on the water to wash the dishes and all of a sudden got to stop and run to the bathroom. Another common one I hear is as soon as I pull in the driveway from being out somewhere, I have an uncontrolled urge to go to the bathroom, and sometimes patients will have leakage associated with that. This one is very common where patients will actually restrict dietarily what they're drinking because they're afraid that if they get an urge to go to the bathroom and they're not in a position where they can deal with it, then they're going to be embarrassed or there's going to be an issue. And so they'll actually restrict their fluids, which we don't want people to have to do either because they're very good treatments that we can talk about. Again, a lot of people revert to using pads or protective garments to help with this. Some patients will have what we call urgency frequency, where they have that strong urge to go to the bathroom, but in addition to that, they have very frequent urges, very frequent trips to the bathroom. They feel like they have to go every hour, every 2 hours, and really kind of what we consider very frequent is more than 8 times during the day. Patients will often describe feeling like they always have to go to the bathroom, or when they go to the bathroom, nothing really comes out. All that kind of falls under this category of overactive bladder, and we're going to talk about some of the treatments for that shortly. These very same symptoms can be present in patients with fecal incontinence. So it is the same thing where patients will have frequent accidents of bowel movements where they have either they'll have an urge to have a bowel movement and can't hold it or can't make it to the bathroom in time, which will result in some stool leakage, or they don't have the ability to feel appropriately when they do have to go, and they'll have some leakage of stool because of this. This doesn't always have to be where your bowel's fully empty. This can be kind of just some, small marks in your underwear or things like that that you're unable to control. And so it really can be very controlling of people's lives when in actuality there's some treatments that we have that we can help control this. So all the doom and gloom is over. So now we're going to talk about the good news, which is that there are treatments that can really get people back to living a normal life, not being tied to pads or to diapers, and not having to worry about where the bathroom is, getting sleep at night, which can be just life changing. And, you know, going from getting up 5 or 6 times at night can get you back to where you can sleep through the night, really feel refreshed and restored and ready to take on the day. So we mentioned earlier our care pathway. And what that means really is that we've tried to set up a pathway for patients that we try to adhere to for the most part, because this really closely follows the guidelines from the American Urologic Association, which have a lot of data behind them that tell us why we should try to approach this problem in this way. And the reason I like to talk about this with patients up front is because there's a large amount of patients that will not come back after their first or second visit for overactive bladder, because if many times our initial therapies don't work the way we want them to, but we do have more therapies. And so I always encourage patients to know this is the pathway that we're following. We may stop early on it because we've got a good solution, but we may need to go further down the pathway, and that's okay. We just want to encourage folks to make sure that we're staying on this pathway so that we can get to the root of your problem and get you to a solution that's going to work. And so after diagnosis, which is really the first step of any of this, we will talk about lifestyle and dietary changes. And none of us like to hear it, but diet and exercise really do play an important role in this. So weight loss can help control urinary symptoms in a lot of people. Sometimes I'll talk to patients about dietary things that we can do. Reducing things like coffee, tea, soda. Those are big bladder irritants, and they can cause people to have worsened urinary symptoms. I have some patients that are able to completely control their symptoms by modifying diet. None of us like to hear that we can't have our cups of coffee during the day, but we have to recognize that that's an important factor in what's going on here. And then thirdly is physical therapy. There are specialists that focus on pelvic floor physical therapy. They're physical therapists who went on for additional training in specifically pelvic floor therapies and exercises that can have a great deal of impact on these urinary symptoms. And we have some great ones in the area that we can help set folks up with to talk about some of these exercises. So step 2 beyond lifestyle modification are medications. And these are kind of the mainstay treatments for the majority of folks when we get started. These are daily medications for the most part. Most of them are once a day. There are a few that are twice a day. And a lot of times they will work well to control symptoms, but they do have other issues. The most common side effects that we see from some of these medications are dry mouth and constipation, which we try to work on. We try to modify medications appropriately to work around those issues. They can cause vision changes in a small amount of patients, and they can lead to some blood pressure changes in some patients. And we're kind of back to this part about staying on the care pathway, because we see that in a recent survey, 72% of people stopped taking their bladder medications within 6 months, whether that's for what they perceive as lack of effectiveness, which may not be working well for them, or because of side effects. But I really encourage people to stick with us through this, because if we're having trouble with the medication, then there are more options. And so what are those options? We call them, in urology, we call them either advanced therapies or tertiary therapies. We call them tertiary therapies because they're in the third tier of therapies in the American Urologic Association guidelines. And so typically, if conservative treatments, which are dietary modification, physical therapy, medications, don't work, we do have some more options. So specifically for bladder control, Medtronic has 2 different systems that we're going to talk about in a minute: the InterStim system and the Neuro system. And then for bladder control, there are injected medications. For bowel control, the InterStim system works extremely well for that as well. And then there are other surgical options. And we go through the risks and benefits and kind of have a discussion about these in the office when it comes time to do so, and talk about how they can fit into your life and really help. So injected medications, Botox is really the by far the leading injectable for bladder control. It can temporarily treat overactive bladder, but does have some drawbacks. It's typically we put a scope into the bladder, and there's a needle that goes through that scope, and we inject this into multiple areas of the bladder to try to help treat the overactive bladder muscle. It's in the trial's effectiveness was comparable to some oral medications, and the one risk that I really quote to patients is depending on the study, we look at about a 6 to 10% risk of potential catheterization. And we kind of tailor that risk a little bit depending on the patient and various factors. But the other real risk to Botox is that it does need to be repeated. Botox will wear off at some point. I tell folks to plan on a couple times a year for injections. Sometimes we'll get a little longer. Sometimes we'll need to do it more often, but I tell them plan on a couple times a year. And you can see that 50% of people stopped after 2 treatments because some patients just get tired of having the treatments, whatever the reason. But again, one of the risks of Botox is that it will wear off and we have to repeat it. So the neurosystem has a very long technical name. It's called posterior tibial nerve monitoring, or nerve stimulation. And really what it is it's a very, very minimally invasive system. You can see in the picture here that it's a tiny needle that stimulates a nerve that's right behind the bump that kind of sticks out on the inner side of your ankle. And what it does is stimulating that nerve, it helps stimulate the same place in the spinal cord where the pelvic floor innervation and the pelvic floor muscles are. And by doing that, it can help reduce urgency to rush to the bathroom frequency, number of times going to the bathroom, and urinary incontinence, leakage of urine. It unfortunately doesn't treat fecal incontinence, but the benefits of it are that it is almost completely non-invasive, and that it is very functional. It works very well. It's a big upfront commitment, kind of like going to the gym to really kind of hit it hard and get going up front. And then we taper off and do monthly maintenance sessions. So typically we do 12 30-minute sessions, and those sessions are weekly. So it's a big time commitment up front. But then if we're getting good results, then we'll do monthly maintenance sessions after that. I typically will meet with my patients about halfway through those 12-week sessions, review how we're doing, review how the therapy's going, and if it's working, and then decide if how we're going to move forward from there. If it's working well, we'll finish the 12 treatments and then start the maintenance program. But I kind of liken this very much to acupuncture. It does not hurt. You kind of come in, hang out with us for 30 minutes, you read a book, you play on your iPad, whatever it is. And then after that, we take the needle out and you go home. And then the third of those things that we're talking about is what's called the interstim system. What the interstim is it's a stimulator, very similar to a pacemaker, but what it does is it very gently stimulates the nerve that controls the pelvic floor and the bladder. And it restores the communication between the bladder and the brain. And by restoring that communication, the bladder fills and empties normally, doesn't send those inappropriate signals or have that communication breakdown with the brain, so that the bladder goes back to having closer to normal function and filling. And when it's time to go to the bathroom, we say, okay, we have an urge to go. Let's get up and go to the bathroom without the leakage, and prevents those inappropriate urges. There's a 2-part process, the test phase, and we're going to go into a little bit more of this in a minute. But the test phase really lets you try the therapy to see how well it works for you. And if it works for you, then we move forward. If we decide to move forward, there's a small battery about the size of a silver dollar that goes underneath the skin, and we discuss where we're going to place that. But it's really kind of in the off to the side in the lower back, where you really don't feel it. It really doesn't interfere with lying on your side or sitting or anything. We try to choose a location that's appropriate for that. And there are two battery options here. One is rechargeable and one is not. And we can kind of go over the risks and the benefits of each one of those if we move on to that point, and decide which one fits best in your lifestyle. So really, we want you to say yes to the test. So if we're at a point where we're in the care pathway and we've gotten to this point where we're exploring these advanced therapies, this is a very simple test that we do. We put a very small wire, thin wire, about the size of an IV needle. There's 2 of those tiny wires that go into the lower part of your back, and they attach to an external device. And if you look in the picture up here, this kind of black belt that the person is wearing here is what it looks like. It's very small. It's very low profile, and you wear that on the outside for a period of about, it can be up to 14 days, but typically it's much shorter. Typically, in my practice, it's about 4 to 5 days, just to give us a really good time period where we can evaluate whether it's working. And we'll kind of communicate with you throughout this test phase to monitor the therapy and adjust the therapy as needed. The programmer that goes with it is a cell phone that's very easy to use. And we track your symptoms to see if they improve. And when we say improve, what we're looking for is a 50% or greater improvement. We get that from some data that will have you fill out on kind of a little sheet that tracks your bowel or bladder function prior to the test. And then we have you do one during the test, and we compare those two, and we see, has there been a 50% improvement or greater? Obviously, I don't. One of the other questions I ask is, I say, great, we've got our 50% improvement, but do you feel like it's helped you? Do you feel like it's improved your symptoms and your lifestyle? Because we're never going to push you to move forward if you don't feel like it's improved enough for you. And so in addition to that 50%, we want to know that it's worked for you as well. And so what we do see, though, is that this is a very safe and effective therapy. And again, if we see that improvement, we go back and we put in the permanent device, which again is under the skin. It's low profile. You can't feel it there, but it does improve significantly quality of life. Up to almost 90% of people experience long-term success with in terms of bowel control therapy. And again, when we say success here, we're referring to 50% or greater improvement. Some patients see far more than that, but at least 50% improvement. And we also see that a huge portion of folks, 76%, we see achieve success with SNM, which is the InterStim device, in terms of bladder control, which is significantly higher than with medications alone. And it really is impactful on folks' lives. You know, they come in and they tell me, I didn't get up at all last night to go to the bathroom, or I only got up once. I got so much more sleep. I'm not wearing pads anymore, or some of them have gotten so programmed to wear pads that they'll say, oh, well, I'm still wearing a pad because I'm so nervous, but it's not wet anymore. And so ultimately we can discontinue those pads. And a lot of folks, they go out in public, they're not worried about where the bathrooms are. So it's a huge improvement in lifestyle. And then ultimately, you know, the question is this therapy right for you? Ultimately, that's your decision, but this is very much a process that we are going to hold your hand through and walk through, and we're going to find a therapy that's right for you. So if the InterStim device or therapy is right for you, if you have significant symptoms of overactive bladder, or in patients that have what we call non-obstructive urinary retention. So urinary retention, you'll remember, is the inability to effectively empty the bladder. This can be an effective therapy for kind of reprogramming that connection and telling the brain again, okay, bladder's full, time to go to the bathroom, and can help with that. Fecal incontinence, again, if you have significant symptoms of fecal incontinence, very large portion of patients see a big improvement. And again, if we've tried lifestyle changes, we've tried oral medications, stick with us, because I assure you that there are therapies that we can find that are going to be a good fit for you and that are going to help. And so when those treatments aren't working, we have other therapies that can be very beneficial for you. So this is just a quote from someone who's you know, had the therapy before. Getting back to doing the things that I love. I'm going out in public and I'm not worried about where the restrooms are, or I can wear And that's another thing that patients often tell me is they buy clothes that are certain colors so that you can't see the leaks, and they say I can go back to wearing the clothing that I want to, or the dressing how I want to without worrying about the leaks, and how are the pads going to fit in my outfit, things like that. And it's very freeing to not be tied to the bathroom, to be able to go out and to be able to not worry about where the bathroom is, or worry, am I close enough to the bathroom, or I can't go to this restaurant because what if I can't get to the bathroom fast enough? So it's a very, and I do hear this from my patients very frequently. It's you don't realize how much hold it has on your life. It's a very freeing experience to be able to control these symptoms. So at this point, happy to answer any questions that you might have. My contact information is right here on this slide, and there's also some additional information on these therapies on the Medtronic website. Their website is actually very informative. I don't say that about everybody's website, but it actually has really good information on there. So feel free to explore that. And then I've got some great literature and stuff in the office too, if we want to talk about that.
Dr. Ellett, thank you so much. Wow, I was taking notes while you were talking because you said so many things that I haven't heard before or in a different way. And you're very articulate and you make things make sense. So thank you for kind of breaking everything down for us. You said something at the end that so resonated, and it was about wearing different colors of clothing. And in a former life of mine long ago, I was a psychotherapist. And so I had clients of mine that, wanted to achieve certain goals. And I was sitting here thinking about how I would reframe this with somebody if I was sitting with them in my practice. And I was thinking exactly along the lines of what you said, sit here and imagine what your life would be like if you were no longer restricted by the bathroom, by mapping out the bathroom at Walmart. You're able to wear white pants again. You're able to go on a date. I mean, you brought so many points home, and I was just visualizing all of it and thinking, how powerful that is to envision a different life. And I think when you talk about the care pathway and that treatment algorithm, it's so nice to know that we are going to have to jump through some hoops, maybe to find out a solution later at the end. Some things are going to be conservative and a little more advanced later, but I might be able to find something quickly, or it might take more time, but to not lose hope in the process, because there are options. And I think if we were told this more often, there probably wouldn't be such a fallout rate with providers. And, I've been in this space now for, going on 5 years, and I've seen a lot of patients bounce from urology to urology practice because they're disillusioned with the care that they were given. And it's not that they didn't like their provider. It's just they weren't getting help, and they thought that that was the end of the road. And so thank you so much for outlining all of this. I do want to get to everybody's questions. I'm going to stop recording.